Hello everyone, in this video I'm going to talk a little bit about why Medicare Advantage is really not a good program for people who have the financial means and the kind of understanding on why it is important to spend money on a Medicare supplement plan and a Part D drug plan when you're on the Medicare program. Alright, let's get into it. There's been a lot of articles both for and against Medicare Advantage on the news, on local and more national level of sites and news sources. And I found a few from MedPage, which is a doctor-run website that has a lot of things that would be geared toward physicians. And one of the articles talked about one of the insurance agents who I actually follow and have been doing a lot of what he says to do as far as helping Medicare beneficiaries, Christopher Westfall, and he talks about how Medicare Advantage plans do pay agents more commission, and Medicare Advantage plans are easier to sign people up for because during the annual election period, all you need is a Medicare ID and a signature. With Medicare supplement plans, it requires a little bit more. It requires underwriting. You also, if you're on a Medicare Advantage plan, you can only enroll in a Medicare supplement plan when you have an ability to disenroll from your Part C Medicare Advantage plan. So now is also time to do the Medicare supplement as well. And many people can be swayed to join a Medicare Advantage plan because Medicare Advantage plans provide things like dental, vision, hearing, a drug plan all included. You get lower copays at the doctor's office. But what they don't tell you is that a lot of these Medicare Advantage plans have a process whenever you receive coverage services. So I wrote a book on how to find a Medicare Advantage plan for you, and the reason I did write this is because many agents out there just want to provide you with the plan that they represent, not the plan that's best suited for the individual. So what I've done is kind of provided a blueprint for people who are on Medicare Advantage to look for a Medicare Advantage plan that might suit their needs. Now it's part one of 3 books that I want to release, the second book being how to use your Medicare Advantage plan, and the third book being how to get out of a Medicare Advantage plan if they want to. So what I'm going to cover today, again, sorry for the long intro, it's going to be the information that is going to really talk about statistics, and we can't really make any statistical interpretation that is quote unquote the truth, but we can make opinions. And me, as someone who has been in the industry since 2014, it's almost 8 years, going into my 9th season of enrolling people in the following year, I have a little bit of experience. My wife is also in the medical field. She is a nurse practitioner, so I hear a lot of things about insurance and having to deal with insurance. So I'm going to be speaking from that angle, from someone who is in to get patient care. There's also a side of the industry which would be many opposing sides. The way I look at anything is there's like this a scam. There is an orb, a 3-dimensional sphere, and that's the item at hand. And then there are people who are looking at it from all different angles, different sides, and they have their opinions, and I'm just one of those sides. But the primary other side of the argument is that Medicare Advantage prevents doctors from frauding the system, and Medicare Advantage also provides beneficiaries a way to get healthier. And that's kind of the whole Medicare Advantage program's goal, is to provide health plan for their enrollees. The Medicare traditional A and B with a supplement plan and a drug plan, that's truly medical insurance. That is to prevent someone from getting into medical debt, or prevent them from having really outlandish medical costs and restricted services. And that's what the original Medicare program is for. So the first thing, and this is data, I've talked about this before, this is balancing efficiency with equity in Medicare Advantage benchmark policies. Came out about 1.5 years ago. I couldn't find a newly updated one of this, so we're going to just use the same thing because I highly doubt it has changed very much. So This shows us that private plans, that's Medicare Advantage plans, have never yielded an aggregate savings to the Medicare program since 2004. And that is truly unfortunate, simply because this program was supposed to save beneficiaries and the Medicare program money. As you know, Medicare Part A is in kind of in the danger zone as far as becoming insolvent. That means that it's running out of money, going to be bankrupt. And also the Part B and Part D cost that beneficiaries have to absorb has been rising. Although in 2023, the Part B is going down by about $7 a month. So it is going down a little bit, but that's because we had a huge uptick in 2022 where the premium went from, I believe, $150 or so to $170. So we're kind of just leveling out that regular inflationary period or regular inflationary amount. In fact, the Kaiser Family Foundation has estimated that there's a $321 cost for someone to join a Medicare Advantage plan versus them to just stay on original Medicare. So it's not like little percentage here showing about like 4%. That 4% is actually equal to about $321 per person. And with about 50% of Medicare beneficiaries on the private plans, that entire amount is, upwards of I think about $6 billion a year in excess cost. And I believe that's a per year cost. It could be per month. And if that's the case, it's even higher. But let's talk about here we go. So this is that MedPage Today article, and it talks about beneficiaries may spend less on premiums, but delays are common. And it talks about this one gentleman who was at the Cleveland Clinic. Okay, so this gentleman at the Cleveland Clinic had to do PET scans to locate a tumor, and the oncologist said the faster move the better. But the oncologist was, he frowned and he said, well, you won't be able to get a scan here for about 3 to 4 weeks because we have to get approved from your insurance, and we'll submit it, they'll reject it. There's a lot of back and forth. Barry, who is this gentleman who is on a Medicare supplement plan, which we find out right here, says that just to be clear, I have regular Medicare with a supplement. And the oncologist happily said, we'll get right on it. And he was able to get his PET scan 3 days later. And the beneficiary, Barry, he said that 4 weeks would have been intolerable. And 4 weeks, as many of you know, to get a scan that would diagnose whether or not you have a tumor, which could be cancerous, can be quite scary, living with that for a whole month almost. And that's very common in the Medicare Advantage space. Now, Medicare Advantage plans do put those safeguards into effect because a lot of physicians, well, not a lot, I'm just going to say there are physicians out there who will order tests for patients who simply do not require them, and they do not even deliver those tests. I believe it was in the 80s, there were many cases where Medicare had to put kind of a stop to it by changing their policies. There were cases where doctors would order durable medical equipment like wheelchairs, oxygen. They would say that Medicare beneficiaries were ordering them, and they would receive the reimbursement for the device, and then they would turn around and sell it retail. So there were these Medicare beneficiaries who did not require anything, but the physicians were ordering things and then selling it, effectively getting paid for ordering it and then selling it again for a profit. So that was put to a stop by having prior authorizations required for some durable medical equipments, even with original Medicare. But what original Medicare wanted to do by implementing private insurance companies is to limit those types of fraudulent services and fraudulent payments. And on the kind of implementation process, when the private insurance companies took these over, instead, what happened was they get delays in care, and there's a lot of delays in care, as this other article came out with and said that Medicare Disadvantage would be a better name. And I have a client who actually said, yeah, forget that Medicare Advantage stuff, that should be called Medicare Disadvantage. And in the article here, she talks about how it actually is, how could it save money when you are actually implementing middlemen to kind of be there to collect more of the premium, right? So how can it be helpful? In addition, Medicare Advantage limits your physician network. So even if they might have all the physicians that you need to see right now, that could change, and the doctors could leave the network whenever they feel fit. So it does kind of bring this kind of, hey, is it really helping me to sign up for a plan where my physicians might no longer accept it? If you have an HMO, that's even worse, because now if you needed help from that doctor who left the plan, you would have no coverage at all. Whereas in the traditional Medicare program, as long as that physician remained in the Medicare network, which is about 90 to about 93% of all the physicians in the US, that would not be an issue at all. Even if you had a Medicare supplement plan from a private insurance carrier, you would not have that issue, because that's just how the original Medicare and supplement program work. A supplement plan has no effect on whether or not coverage is going to be given to you. It's all up to the original Part A and B, and the supplement just acts as a financial stop to as far as how much Medicare can charge you, because Medicare itself has an unlimited financial responsibility for beneficiaries who are on it, on the Part B side of the fence. The next thing is that, and this was kind of alarming. This article just popped out, or at least to me, very recently, and it said that on the last year of life, many Medicare beneficiaries leave their Medicare Advantage plan and join or go back to the original Medicare program simply because, well, they can't say simply because. The article just points to, in these facts, and this is a government sanctioned study, they found that the amount of, here's the statistics here. So it's quite a bit of, like, it's more than double the amount of beneficiaries that leave Medicare Advantage on a regular basis versus leave Medicare Advantage on their last year of life. And it could be due to getting the doctors that they need to see, nursing home potentially, and just basically ease of care. And that is quite alarming, because Medicare plans are supposed to cover you for the entirety of your life, and changing your Medicare plan is something that you do on an annual basis. But if you're on the original Medicare program with a supplement, you simply need to just be able to pay the premiums, which again is a financial responsibility, to stay enrolled in the supplement plan. So it's something that many people kind of think about, and I did an article about this too. You can check in my video about how Medicare Advantage is said to save a lot of money in retirement, a lot of money, like $100,000+ of money for the entirety of your retirement. But will it actually save you money if you have all these complicated medical things that won't get covered or take too long to get covered, right? Is that really worth saving that $100,000 in exchange for getting, a little bit more restricted care level? And some people, that answer is yes. Some people, that answer is a big no. And that just depends on where you are. But more and more information, as more and more data comes out, we can see that, as people need more care, they tend to need to either move to a Medicare fee-for-service, and if they did, they'd be paying a lot of money out of pocket at this point. So all those savings could potentially disappear when you go back to the fee-for-service model, because typically if you are moving to a fee-for-service model because you have all these medical complications, then you will not be able to qualify for a Medicare supplement plan, Therefore, you may have to be paying, or you may have to pay a whole lot more out-of-pocket costs due to Part B having no cap on the amount that you can be charged for services, and nursing home that deductible being $1,600. So it could cost you more if you are moving for those reasons. Next article. So this is along those same lines, and this is the one where they said it was $321 per person for the entire year, and this is 2019, so I can only assume that this number is getting higher. So even with spending going down, Medicare spending would still be lower, but that would take all the way up until 2029. So it's going to take a while to get there, and as history has shown us, Medicare Advantage has still not saved any money yet for the Medicare program. And this is where I mentioned earlier in the video, Christopher Westfall said that most agents would earn double if you sell an MA, Medicare Advantage plan, versus a Medicare supplement plan. I can also tell you, in certain states that I'm in, I actually get paid like a fourth or a fifth of what selling a Medicare Advantage plan will provide to me. And while you might think, well, that's you should always do the best thing for your client, there are many agents out there, Medicare insurance agents, who don't really understand the true differences between Medicare Advantage and Medicare Supplement. I myself sell both. Like I always say in many of my videos, I would, if it was my personal opinion, I would go with a Medicare Supplement plan, but everyone's needs are different. So for some people, enrolling in the Medicare Advantage plan is really their only option due to the financial constraints, right? The Medicare Supplement plan premium can go up every year, and most times it will. As you know, health insurance, medical spending, healthcare costs are all going up. So these Medicare Supplement plans will be going up as well. So if you can't reliably pay for that premium, then it is really difficult to buy that plan. Additionally, Part D, as in dog, the drug plan, is included at no cost in a lot of these Medicare Advantage plans. And if they were to choose a Part D plan, it might cost them an additional $40, $50, $60, $70, even $100 a month more for that Part D plan that they need to cover all their medications. So in many cases, they are kind of stuck between a rock and a hard place. Either they get the coverage that they can afford, or they risk potentially having a restricted network. And it really is a no-win situation, which I can understand. I myself, everyone who's not over 65, not on the Medicare program, actually has no access to one of these models, a kind of, I guess, free model that isn't restricted by insurance companies and isn't restricted by network like you can be, or you don't have to worry about when you are on a Medicare supplement plan with original Medicare. You have no real worry about network, and you have no real worry about the insurance company kind of mingling and preventing you from getting certain services done. So in this article, he talks about how his staff still does Medicare Advantage, but only for those types of folks. And that's kind of where I'm in. I talk to a lot of people about like the freedom and flexibility and all that stuff with the Medicare supplement plan, but some people still choose the Medicare Advantage, and I just want them, if they are in that program, to keep sufficient medical records to make sure that they know that, hey, we are going to run into like roadblocks, so to speak, with the Medicare Advantage program, but that's a known. It's not an unknown. So you have to know about it, and you have to prepare for it. So while no one wants to prepare for those kinds of things, you have to at least keep it in the back of your mind that you will have to kind of work a little bit harder with you and your doctor for more expensive, more complicated services. This article talks about the amount of services that were denied, kind of without reason, for services that are routinely approved. And now instead they are routinely denied. So this study is very along the same lines as, it's the same study, as many of the other things that I talked about. Every year or every 5 years, the Office of Inspector General does bring out a report, and that report talks about how many different plans were denying, and of their kind of services, of their survey kind of red flags that were happening, and it's all along the same. They did a report in 2016 which showed that many services were denied, and when they were appealed and sent to the process of CMS to have an appeal done, they were approved. But unfortunately, less than 1% or so of cases were actually sent to appeal. So a lot of these people, when they were denied services, they just simply didn't try again or didn't appeal that denial. So it's unfortunate. Last thing, nursing home. So in the nursing home, Medicare Advantage plans, and I talked about this in another video as well, you can check it out, but Medicare Advantage plans kick out their members from the nursing home after around in this case 11 days, and this person, the daughter of this 97-year-old who was told to leave the nursing facility, said it seems unethical. And many of the I guess nursing home workers and stuff will say they'll never join a Medicare Advantage plan simply because of this fact here. And I would say that yes, I mean, looking at this, I would say that for sure someone who is in their last year of life or getting to the point where they need a lot of medical attention, a lot of times it is not that the cost of the nursing home is too expensive, really, with quotes. It's more that they want as much help as they can get for getting coverage that they think that they need, and that's what the Medicare program will do. So if they just kept that Medicare or signed up for Medicare supplement from the time they were eligible, and continue to make sure that while you're healthy you shop for a new one to keep the cost as low as possible and keep a company that's strong so that you won't have huge rate increases, then you'll be able to save thousands of dollars when you do need that care, and whether it is at the end of your life or at some pivotal moment where you have a tumor or a cancer or anything like that, those costs could be recuperated, and it at least gives you that real kind of sense of, okay, I really do have the best medical coverage that I could possibly have. Well, yes, you don't get the free gym membership, you don't get the dental, you might not have the the most flashiest drug plan and all these extra bells and whistles in your plan, but you know what, when it comes down to the medical coverage, that financial responsibility and access, you will have a lower financial cost when things occur. You may have a higher premium, but lower financial costs when the proverbial stuff hits the fan, and you'll have access to the providers and access to all the services. So that to me is the reason why you get medical insurance. So I would say that for the most part, while you are shopping this year for the newest Medicare Advantage plan, if you want a Medicare supplement plan, or if you ever heard of people getting denial of care and you don't want to go through those things and you just want to keep it easy and you're willing to pay a premium, look to getting a Medicare supplement plan. And I have videos on my channel. There's other people out there who specialize in this stuff too, so you don't have to utilize this video, but I would suggest utilizing the resources that you have out there to make sure that your plan is the right plan for you. And you have, if you're on a Medicare Part C plan, if you have health on your side, you still have time on your side, because there is still time to enroll in a Medicare supplement plan. And you would do that simply by signing up for a Part D plan to start on January 1st, and your Medicare supplement plan after you get underwritten to start on January 1st as well. But you have to get the supplement plan approval first, and then you can process the Part D to kick you out of that Medicare Advantage plan. There's also another chance you could do that during open enrollment period, which is from January 1st to March 31st. but the sooner you do it, the better, simply because we never know what could happen tomorrow. If you happen to have something happen tomorrow, then the Medicare supplement plan wouldn't be able to underwrite you if you had a scan done or you have something pending. So make sure you kind of keep those things in mind when you're shopping for plans this year. I'll see you in the next video. This was a long, lengthy one. I kind of wanted to do this for a while. Hopefully you learned something. If not, hopefully you at least enjoyed this talk about how Medicare Advantage is actually Medicare Disadvantage.